Hello, and welcome to Blood Type and ABO Compatibility. I'm your lecturer, Melissa Dono. So, often in healthcare, it is necessary for physicians to order blood transfusions, either for emergency procedures or during routine surgical procedures. Now, once a blood product is ordered by the physician, the laboratory is going to perform a series of tests. These tests are going to ensure that the correct type of blood is selected and that the blood is safe to transfuse. What the laboratory performs is usually called a type and antibody screen and a cross-match. Now, in this lecture, I'm going to cover the history of blood transfusions, the laboratory testing procedures, and the clinical application of blood products. Now, in 1901, Karl Landsteiner, who was an Austrian physician, was able to discover the first three human blood groups, the ABO system. And later, in 1930, he actually received a Nobel Prize for that discovery. And Karl Landsteiner continued his work, and in 39 to 40, him and a few other physicians listed on the slide were able to discover the Rh blood group system. In the 1940s, the U.S. government established a national blood collection program, and a physician named Edwin Cohn developed a method of breaking down plasma into components in different products, such as platelets and fresh frozen plasma. Now, in 1941, the Red Cross began the National Blood Donor Service to collect blood for the U.S. military. And it must be noted that most blood banks until about the 60s were developed mainly for the use by people injured during war. As we move to Section 2, we should note that there are about 30 different blood group systems, and they contain over 600 known red blood cell antigens. Now, for our intents and purposes, we are only concerned with two for the blood type. The ABO system and the Rh system is how we essentially get our blood type. And traditional blood testing and screening is going to be based on reactions between antigens contained in the red blood cells and our serologically available antibody serums, and also antibodies that are contained within the patient plasma. Now, we also perform what is called an antibody screen. An antibody screen is going to help identify antibodies against other antigens from other blood group systems. And we're going to cover that in a little bit later. Now, as we move on, there are four major blood groups, and they are determined by the presence or absence of two particular antigens. That's antigen A and B. And those are going to be located on the surface of red blood cells. And also, we're going to have two antibodies present in plasma. And they are going to develop at about 6 months of age, and they're going to develop against antigens that the person does not possess. So therefore, if you have a person who is an A individual, they are going to have B antibodies in their plasma. So if we look below here, we can see that group A has only the A antigens on red blood cells, but it has the anti-B in the plasma. Group B is going to have the B antigen on the red blood cells and an anti-A in plasma. Now, group AB is going to have both your A and B antigens on the red blood cells and no antibodies in the plasma. And group O is going to have neither antigen on the red blood cells, but it is going to have both anti-B and anti-A antibodies